Hydrochlorothiazide is used alone or together with other medicines to treat high blood pressure, hypertension. High blood pressure adds to the workload of the heart and arteries. If this continues for a long time, the heart and arteries may not function properly. This can damage the blood vessels of the brain, heart, and kidneys, resulting in a stroke, heart failure, or kidney failure. High blood pressure may also increase the risk of heart attacks. These problems may be less likely to occur if blood pressure is controlled. Hydrochlorothiazide is also used to treat fluid retention, edema, that is caused by congestive heart failure, severe liver disease, cirrhosis, kidney disease, or treatment with a steroid or hormone medicine. Hydrochlorothiazide is a thiazide diuretic, water pill. It is used to help reduce the amount of water in the body by increasing the flow of urine. It may also be used for other conditions as determined by a doctor. This medicine is available only with your doctor's prescription. This product is available in the following dosage forms: capsule, tablet. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. The following information includes only the average doses of this medicine. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time allowed between doses, and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For fluid retention, edema, for oral dosage forms, tablets. Adults, the usual dose is 25 to 100 mg daily as a single or divided dose. Your doctor may want you to take this dose every other day or on 3 to 5 days each week. Children, doses based on body weight. It must be determined by a doctor. For high blood pressure, for oral dosage form, capsule. Adults at first 20.5 mg or 1 capsule once a day. Your doctor may want you to take this alone or together with other blood pressure medicines. Your doctor may increase your dose as needed. However, the dose is usually not more than 50 mg per day. Children, using dose must be determined by your doctor. For oral dosage form, tablets. Adults at first 25 mg once a day. Your doctor may increase your dose as needed and may be taken as a single dose or divided into 2 doses. Children, doses based on body weight and must be determined by your doctor. Contraindications: severe renal dysfunction, liver failure, severe forms of gout and diabetes mellitus, hypersensitivity to sulfonamides. Special instructions: use with caution in patients with gout and diabetes. In patients with renal insufficiency, systematic monitoring of plasma concentrations of electrolytes and CC is necessary when signs of potassium deficiency appear, as well as with the simultaneous use of cardiac glycosides. The appointment of potassium preparation of potassium-sparing diuretics is indicated. With prolonged use, a diet rich in potassium shall be followed. The simultaneous use of diuretics with NSAIDs is not recommended. Storage. Store the medicine in an enclosed container at room temperature, away from heat, moisture, and direct light. Keep from freezing. Keep out of the reach of children.